Hello folks, I'm Dr. Fazil. You're watching March 2026 edition of Dr. Fazil TV show. Today we're going to talk something which is very common medical issue is diarrhea, like loose stools. And sometimes it can cause abdominal pain or colicky abdominal pain. So it is a common problem, so I think I thought that we should discuss about it. And today I'm going to talk about what are the sources of diarrhea and what can you do to fix it, and make sure you also don't miss the warning signs of diarrhea. There are certain conditions which are we cannot ignore as just a regular source of diarrhea, or like colon cancer and lack of blood supply to the colon, and that can also cause diarrhea. So obviously, we're going to talk about all that. So let's start. So basically, diarrhea means when you have more than 3 or 4 loose stools a day, or more than your normal bowel habits. The quantity or the frequency of your bowel movements increases, we call it diarrhea. So that's the definition. Generally, it's loose stool. Sometimes there's a blood in the stool, so that's important information you have to pass on to your provider. Your blood in the stool and abdominal pain. So basically, you have we have you can see a hologram right here, and you can see on the left side, this is abdominal cavity. We have esophagus, a stomach, and then a small intestine and a large intestine, and then obviously the rectum, right? So basically, the diarrhea happens when you have issue with the large intestine, the large intestine problem, right? Most of the time. So basically, you can have infections as source of diarrhea. You can have an infection could be viruses or bacteria, or it could be even a medication side effects. Certain medication like iron tablets cause diarrhea a lot of times. So it's a good idea to, when the provider is talking to you, give the list of the medication you're taking. So if there's a medication which might be causing diarrhea, like iron preparation, magnesium supplements, that will cause diarrhea. So get rid of all that before we do any more invasive workup or treatment, right? So among the different sources of diarrhea is the IBS, irritable bowel syndrome. I think I should focus mostly on that because it is pretty common in our society. And then the role of probiotics and stuff like that, right? Folks, so basically the most common way to find out if you have IBS is that does it wake you up at night? So the easy way to understand the IBS or irritable bowel syndrome is that it's like anxiety of the intestine, right? So most people have anxiety. If some people have anxiety, it can present in different fashion. Some people have more effect on the general body. They sweat a lot. Some people have diarrhea, and then the treatment is obviously different. So in IBS, I was talking to a patient, and I said, I think you have IBS, and I think the significant other said, oh no, it is not IBS, it's a BS. Well, it was a joke, but it just got my mind, like, okay, it's not BS, it is actually a real problem, right? So a lot of people, they have IBS when they are trying to travel. They cannot travel because they have concern about going to the restroom all the time. So the treatment is important, diagnosis is important. So once I have ruled out everything else by taking good history and examination, then you can say, okay, are you an anxious person? If yes, you're under stress, does it wake you up at night? No, it doesn't wake me up at night. Obviously, when you're sleeping, you're not anxious. So that's a good way to find out if it is IBS. The treatment I generally use is Colstat. Colstat is a medication which, kind of take away the toxin from the intestine and give it rest. And that's pretty effective in treating IBS, right? So folks, that's the IBS, right? So that's kind of like common thing, but it's there.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Rest is the medication side effect. A few medications very commonly, for example, magnesium supplements and then iron supplement that can cause diarrhea. Some weight loss medication has been found to have diarrhea as well. So history is important for medication. Obviously, other sources like food poisoning or viral infection can also cause diarrhea. They generally comes and go, and they're short-lived. The trick is that if that's the case, then stay hydrated. Drink enough fluids with electrolytes, and then if it go more than a week, you should see your provider, because it might be more than that. Well, other sources like infection, ulcerative colitis or colitis, and that's treated by antibiotics. The workup could be X-ray of the abdomen and then a CAT scan if needed, plus stool test for white cells in the stool or sometimes C. diff. Okay, let's talk about C. diff. That's an important topic because sometimes people go to the hospital to meet their relatives, or they were admitted in the hospital, and C. diff is a bacteria which you can pick up by contamination, and it's very bad bacteria because it is difficult to treat. The treatment is possible, but you have to diagnose first. So if you have been exposed to C. diff by going to the hospital or staying in the hospital or in certain setup like that where there's sick patients, so you can pick up that infection, and it can live in your nose too, by the way. C. diff can stay in your nostrils. So that's why sometimes you have to take the nostril sample and make sure you don't have C. diff contamination, or we can do a stool test. And the treatment is with vancomycin or flagyl for like 21 days. So, and if you don't do it, it will not go away. And you can have a C. diff infection also from prolonged use of other antibiotics. It is an opportunistic infection, right? So folks, that's kind of like infectious source, anxiety source, and then also the medication side effect. Few other things which we have to be careful is colon cancer. So if you have change in bowel habits and after age 45, like you have constipation or diarrhea and you didn't have it before, then obviously you should get scoped, make sure there's no growth in the stomach causing, or in the intestine causing diarrhea or constipation. So change in bowel habits can also be an indication of some kind more serious, right? So that's an ominous sign, ominous problem, like you don't want to miss cancer, C. diff infection. And then while we are treating and diagnosing it, journey by blood and stool test, and by doing probably imaging study like CAT scan or colonoscopy, for extreme cases. Stay hydrated, if you don't have an issue with the fluid retention, drink water, electrolytes. Other thing is obviously very common problem is that you might have constipation and still have diarrhea, right? And that's kind of confusing because sometimes we do, for example, X-ray of the abdomen. Here you can see the X-ray of the abdomen is showing the colon with the stool inside, and still you have diarrhea. Well, what's happening is in that situation is that still the intestine is full of stool, and then when the new stool come in, it doesn't have any room left to get solid. It kind of overflow over the old stools. So when we do an X-ray, we find constipation, but patient have diarrhea. And when we tell the patients, hey, you have constipation, but patients say, no, I have diarrhea. The explanation is that chronic constipation can cause stool retention, and then there's no room left for new fecal material come in to get solidify in the colon, it just overflows. So it's like, we call it overflow diarrhea. So the treatment actually would be treatment of constipation. That's kind of strange, huh? So once you're on the right track, you know the diagnosis. Well, basically you just do a detoxification, get rid of all that old stool by enema or by good colonic, then the diarrhea will stop. That's kind of paradox, but it is what it is, right, folks? So that was some very important and basic information about diarrhea, what is diarrhea, what's the causes, and how we diagnose it, and the treatment. Treatment is find the problem and fix it. And while you're fixing it, sometimes you have to give antibiotics for sedative, but most of the time, it goes away if you stop the offending problem. And while that's happening, stay hydrated. Drink fluids and take care of your electrolytes. Folks, on that note, I will call it a day. Thank you for watching Dr. Fazil TV show. God bless you and God bless America. I will be back next month with more useful topic for your health. Stay tuned. Thank you so much. Dr. Fazil here.